Hello, everybody. This is Kobe Pope, owner and creator of Wolf Self Care Products. Happy PCOS Monday. Today, we are talking about PMS, dysmenorrhea, menopause, and PCOS. Three things we need to know about magnesium and PMS. Chocolate, which someone will crave premenstrually, is high in magnesium, but the added sugar and fat in commercial products make it far less desirable as a regular part of your diet. Use raw cacao in recipes instead. Number two, Prozac has been patented under the name Seraphim for PMS. PMS is caused by magnesium deficiency, not a deficiency of Seraphim. Number three, magnesium is a safe treatment for PMS and PMS headaches. Boom. All right, we're going on to a study by Mevlin Werbach showing that 192 women taking 400 milligrams of magnesium daily for PMS, 95% experienced less breast pain and had less weight gain, 89% suffered less nervous tension, and 43% had fewer headaches. Doctor, we're back. Oh, no, you're good. Thank you. You're good. Um, Advises women should take 50 milligrams of vitamin B6 daily with magnesium to assist in magnesium absorption. However, the person talking is not in favor of high dose B vitamins because they're all synthetic. They would rather people take methylated B vitamins found in food-based B vitamins from nutritional yeast. Magnesium RBC tests show low levels of magnesium in women with PMS. Even serum magnesium levels, which are low only when there is a severe magnesium deficiency, diminish significantly in premenstrual week in a group of 40 women. Okay. In another innovative research study, magnesium ion levels were tested several times during the normal menstrual cycles to determine magnesium and calcium levels in relation to the menstrual phases. There are comparatively high magnesium ion levels in the first week after the onset of the period. Statistically significant decrease in magnesium ions mid-cycle around the time of ovulation, and a large decrease in ionized magnesium and serum magnesium levels when the serum progesterone concentrations peak in the third week. An elegant study demonstrates that estrogen and progesterone, the female sex hormones, influence magnesium ion levels in the body, which may explain why magnesium relieves symptoms of PMS, including migraine, bloating, and edema. Exposure to increased concentrations of estrogen induce significant loss of magnesium ions. At the highest concentration level, magnesium ions decrease approximately 30% in comparison with control. Okay. The higher the estrogen or progesterone concentration, the lower level of magnesium ions. There's an experiment indicating that normally low concentration of female sex hormone estrogen and progesterone helps cerebral vascular smooth muscle cells sustain normal concentration of magnesium ions, which are beneficial to vascular function, whereas high levels of estrogen and progesterone significantly deplete magnesium ions, possibly resulting in cerebral vessel spasms, and reduced cerebral blood flow, thus leading to premenstrual syndrome, migraine, and possible risk of stroke. Elevated levels of progesterone and estrogen and birth control pill can cause magnesium depletion and a similar list of symptoms. And we're talking about the symptoms of anxiety, craving, depression, hyperhydration, weight gain. Okay. Now onto the topic of PMS and depression. Women can get depressed before their period, but it's a biological chemical depression caused by the fluctuating hormones and magnesium deficiency. Yet it is usually considered by medical doctors and pharmaceutical companies to be a psychiatric condition suitable for treatment with selective serotonin reuptake inhibitors such as fluoxetine, Prozac, Seraphim. Remember that a lack of fluoxetine does not cause PMS symptoms. A lack of magnesium does. Replacement of magnesium in the body will treat PMS and cause no side effects. fact, it has also been found that magnesium relieves the depression and premenstrual syndrome by positively influencing serotonin activity naturally. Seraphim can make no such claim. Diet advice for PMS: eliminate alcohol, coffee, white sugar, white flour, gluten, fried foods, trans fatty acids. Eliminate animal protein, especially the week before your period. Red meat contains arachidonic acid. Okay. For vegetarian protein, choose fermented dairy, lactose-free cheese. Okay. Vegan protein choices include legumes, gluten-free grains, nuts, and seeds. Healthy carbs include raw and cooked fermented vegetables and 2 to 3 pieces of fruit daily. Essential fatty acids from food sources, fish, nuts, and seeds, including flax seeds, are healthier than processed supplements. For fat and oils, choose butter, olive oil, flaxseed oil, sesame oil, and coconut oil. A diet survey comparing PMS sufferers with women without PMS showed that PMS group had an extremely high intake of sugar, more carbs, more dairy, more sodium, less magnesium, zinc, and iron, which the following percentage is 275% higher in sugar, 79% higher in dairy products, 78% higher in sodium, 77% lower in magnesium, 60% higher in refined carbs, 53% lower in iron, 52% lower in zinc. Increasing magnesium intake by eating raw cacao and more nuts, whole grain, seafood, and green vegetables by taking magnesium supplements. Okay. All right. Dysmenorrhea, painful periods. Taking magnesium without calcium before your period may forestall the pain altogether. Okay. All right. Magnesium and menopause. 34 symptoms of menopause are actually identical to the symptoms of magnesium deficiency. Polycystic ovarian syndrome. Patients had a high incidence of insulin resistance and glucose intolerance. 2 clear symptoms of magnesium deficiency. Since a low magnesium ion level and high calcium to magnesium ratio are associated with insulin resistance, cardiovascular problems, diabetes, metabolic hypertension. A study was done on a group of PCOS patients to determine the effects of magnesium intervention. Significantly lower levels of ionized magnesium and serum magnesium and a significantly higher calcium to magnesium ion ratio were found in the PCOS patients compared to. Okay, that is all I got for you guys today. Thank you for watching. The topic of PMS, dysmenorrhea, menopause, and PCOS. You know where to shop the best supplements, www.clfcre.com. Thank you. Happy PCOS Monday.